One of the most common sick visits we see in the winter months are patients coming in for symptoms we relate to a cold. It's also the most common visit in which you as a patient leave the office without receiving much in the way of care. It can be kind of frustrating. So when should you go in, and when is it better to stay home? In this video, we're going to give you the tools to help you make a better decision of when you need to be seen. Also, make sure you stick around till the end, where I'll share with you one of my latest tips on how you can save money on your health care. All this and more coming up. Welcome to Family Med, your medical home for practical and accurate information to help your family make healthy decisions. I'm Dr. Eric Richardson. My passion is helping you cut through all the health information clutter on the internet. If that sounds like the kind of information you or your family needs, make sure you follow along with us. Hit that subscribe button and share it with your friends. Okay, so today we're talking about the common cold. We've all had it. In fact, maybe you have it right now, and that's why you're watching this. So what's going on? Well, the common cold is an infection of your nose and your throat. We call it the upper respiratory tract. Even though it may not feel that way, it's usually harmless. It's caused by one of the several different viruses. Now, a virus is a small particle that is able to enter into a cell and cause an illness. The problem with a virus is they cannot be killed by an antibiotic. That's why usually when you go see your doctor and it's felt that you have one of those viral infections, you get a pat on the back and a sympathetic smile, a nice big bill in the mail. There isn't any cure or treatment that we can give you that's going to take this away. The reason they call it a common cold is that everybody gets it. Kids more than anybody. If you're under 6 years old, you're at even greater risk. Kids have an average of 8 to 10 colds a year, while adults tend to average between 2 and 4. We get them a lot, and they can happen all year round. Now, we're all familiar with what a cold feels like. Symptoms usually appear in 1 to 3 days after exposure to a cold-causing virus. It tends to start out with that tickle in the throat or your nose and progresses to a runny or stuffy nose. You get that sore throat, the cough, congestion, slight body aches, or a mild headache. You may have some sneezing or even a low-grade fever. Generally, you just don't feel very well. You tend to get a lot of nasal discharge and mucus production. However, one important thing to note is that the longer your cold goes on, it's normal for your mucus to become thicker and yellow or green in color. This is just the normal progression of a cold and isn't an indication of a bacterial infection. So, just because you're coughing up phlegm or blowing your nose and there's color to it, does not mean you necessarily need to go to the doctor. So most symptoms usually last between 7 to 10 days, but it's not uncommon to have a cough or other symptoms that can last up to 3 weeks. So all these symptoms are miserable, but when is it that you need to come see me for it? Let's start with adults first. First of all, you should seek medical attention if you have persistent fevers over 101, or fevers lasting over 5 days, or a fever that returns after being symptom-free for a while. Also, if you're having shortness of breath or wheezing, severe sore throats, headaches or sinus pain that aren't relieved by your typical treatments. If you're having these symptoms, most of them can be taken care of at your local doctor's office or urgent care. So, unless you have severe life-threatening symptoms, I'd talk to your doctor before making a trip to the ER. So how about your children? When should you take them in? In general, your child doesn't need to see the doctor for common cold. You should go see your doctor though if they're having, let's say, persistent fevers, severe ear pain, excessive fussiness, symptoms that are worsening or failing to improve, or for more significant symptoms like if you have a fever over 100.4 in an infant that's less than 2 months old, or if they're having wheezing or difficulty breathing, if they're having unusual drowsiness or unable to keep fluids. You should also seek this care more urgently. Now, I'm not going to give you any specific advice about where you should go if you feel you or your child need to be seen, but in general, most cold symptoms that have persisted can be seen in your doctor's office or local urgent care, and typically don't need emergency care. Certainly consult your doctor on the most appropriate place for you to be seen. So typically with most cold symptoms, it's best just to give it a little time. Let things play out, and usually they'll start to get better on their own. The only time that you wouldn't is when you think you may have the flu or influenza. We'll discuss the flu in a future video, but it's important to know that if you feel like you have flu symptoms, then you should be seen within the first 48 hours of symptoms, as there are some treatments that could potentially help. Now, here's a table from the CDC that discusses the difference between the two. I'll put it also down below in the notes. But it's important to understand that the biggest difference, though, is really how quickly it comes on. The cold tends to be gradual, and the flu typically hits you out of nowhere with a feeling like you want to die. If that sounds like you, then get into your doctor and be tested. The majority of the time, though, a cold is just a cold, and typically can be taken care of at home. In an upcoming video, we'll talk a little more about what you can do at home, but for now, we're just focusing on helping you know when it's the most important to be seen. So that's it. If you missed anything, go on back, watch it again, or make sure you check out the notes section below for a review of what we talked about today. I hope you found this information presented useful today. If you did, don't forget to like, subscribe, and even hit that notification button, as well as share it with your friends. This is key to helping me be able to continue to produce this kind of content for you. Also, let me know what you think in the comments below. How many colds do you tend to get each year? And what secrets do you use to keep them away? Let me know. I'd love to hear from you on those notes. Remember, my purpose in sharing this information for you is to educate you in the things that you can think about in trying to make decisions in your own health. In no way should it be taken as direct medical advice to you in your own situation. So please, consult your own doctor for concerns regarding your specific situation. Okay, as a thanks for those who have stuck around, here's your bonus tip. One of the biggest ways to unexpectedly rack up a big medical bill is to go somewhere out of your insurance network. It doesn't happen as much when you're seeing your primary doctor, because that is something likely you've already researched. Where I've seen patients get burned is when they go get labs or imaging, or even go see a specialist that I've referred them to. As a physician, I'm not going to know who is or isn't in your network, as there are so many different insurance plans. So, as much as I try to send you to someone that takes your insurance, I can't guarantee that I'm going to know. So always check with your insurance carrier before getting any kind of care to make sure that they are in your network. It will save you a ton of money. Well, that's all we have today. I hope this was helpful. Make sure you check out our other videos for information to help you make your medical decisions. So, until next time, this is Family Med with Dr. Eric Richardson. Remember, please take care of your body because it's the only one you have.